So I've decided to make a quick video just about buccal fat removal. I think I've done it before in the past, so this is a bit of a repeat, but I wanted to make one that we can post just to answer questions, because we get a lot of questions about buccal fat removal, or in different countries they call it bichectomia, and it's very popular. And it's something that I have a lot of experience with, and I've seen a lot, and am able to see more than a lot of doctors are able to see or understand about buccal fat removal, because I work in a practice that's filled with seeing revisions and complications and things like that. So, quick explanation of buccal fat. Buccal fat is an essential support structure in the face. If you're looking at the cheek from the side, everything from the top supports what's underneath it. So this part supports here, this part supports here, this part supports here, and so on. The buccal fat itself is a slippery type of fat. It's not one that is present in the rest of the face, nor is it present in the body. It's a slippery, beautiful type of fat that's kind of in a sack, and it just glides around in this plane in the cheek. And it's a support structure directly for what's beneath it, which is this fold and the area that we call the marionettes and the gel. Okay, so it's a support structure for these things. When you remove buccal fat on somebody, you go from inside the mouth, you open up a little tiny hole, and you can diminish the amount of buccal fat they have there with the intent of slimming the face, like that, getting this area to go in. It doesn't do exactly that, but that's the general idea, is that you want it to slim it. Now, that's the benefit, and that's if it works properly. So I do buccal fat removal, but I do it very, I'd say, sparingly or conservatively or rarely. And it's because most of the people asking for buccal fat removal are early 20s and maybe 19, 20, 25 years old. And they're in a transition at that point in their life where they're going from baby fat to adult fat, and they start to slim out anyways. Right after that. So if you go take out buccal fat on somebody who still has the baby face, you take it out and they look okay at that point, but then 5 years later they start to slim out anyways. Now you've kind of screwed them, because they don't have enough fat here, and this part of the face starts to collapse, and they get a premature or accelerated aging in the marionette. So they end up looking kind of deepened over here, and it's a deepening that you can't really fix. It's very difficult to replace buccal fat. So when do I do buccal fat is for somebody who is past that part of their lives. They're 25 years old plus, they've already slimmed out, and they have excess. They have too much rounding here. And it's not that they have a heavy face. A heavy face will not be benefited with buccal fat removal. It's that they specifically have a bulge here. And when you're younger, the bulge is higher. When you're older, the bulge is lower, because the buccal fat gets ptotic. It gets ptosis, meaning it gets drooping. So the buccal fat does bulge more and get lower later in life. So it's located in a different position. In those cases that people have excess, I go decide how much to take. Do I want to take half of it, a quarter of it? You don't want to take all of it, because again, you will get hollowed. So I usually take 25%, 50%, and then I can do profound on the skin to tighten it up instead. Where you get into trouble is when people take too much, and then it makes them look gaunt. So we look at people like the Hadids, who are very beautiful structurally, and at a very young age, it looks like they may have removed some buccal fat. Sure, it looked kind of cool in the beginning because they get a little bit more of that contour, and it looks nice, but then you look at them 5 years later, they're 25 now, and they look 35. They're 30 and they look 45. And it's because they've lost the support structure in the face, and they've gone towards skeletonization. If you look at somebody who's 90 years old, they're fairly skeletonized, and their balance of soft tissue versus skeleton has gone in the direction of skeleton. If you do that to somebody prematurely, they will look older faster, because their balance of soft tissue or skin, fat, and supportive structures is off compared to the skeleton or the bone in their face. So they end up looking older and more gaunt and much, much earlier. So I typically advise people to be very cautious about buccal fat removal. Most doctors and surgeons don't see the problems, and they think that weight on the lower part of the face is going to be improved by removing buccal fat from there. And in most cases, it's not. And you'll actually get deepening of these folds over here, where they get darker and they get pretty deep shadows. and you cannot fix that. So it becomes something very difficult to fix, and you have to add volume back into the face, and buccal fat can't be replaced. So you're not replacing it to fix it, you're actually replacing it with something else, and you have to put Sculptra to replace some fat in that area because you can't get fat from anywhere else. And then you have to go do skin tightening to diminish it, or you have to do a facelift early to fix the problem. And this is what we see. And I've seen this on a lot of models who have done it, and again, in their early 20s, and then all of a sudden they're 30 years old and they look like they're 40. So I do buccal fat removal, but I do it conservatively, and most of the time I'm telling my patients who I consult with, no, don't do it. It's going to make you look older and worse and collapsed, and it's not going to benefit you. And most doctors don't see that, unfortunately. Most doctors are aware of the fact that it can age you. They just don't know how. And I'm telling you specifically, that's how it can age you. You lose that structure in the face. The lower part of the face collapses because this supports this. So I advise doctors who do it, make sure there's excess. Make sure there's excess then and 5 years from then. Not that you're doing a 20-year-old who's going to slim out anyways, because you just screwed them for 5 years in the future. Make sure they're somebody who's going to remain in excess. They have a face, they weigh 150 pounds, but their face looks like it's 300 pounds. That's somebody who can actually afford some buccal fat removal, and then combine it with a radio frequency to kind of tighten the skin so you don't have to remove as much to get the effect that you want. So just everybody be a little bit careful about doing buccal fat removal. If you do it, make sure you're doing it with somebody who is aware of those things. I don't know how you find that out, but I'd say, look at other options first, maybe profound skin tightening, that kind of stuff, and then go into it. So that's our informative session. Hope that helps. Maybe I'll come out with some other ones about other things people have been asking about. People still ask about threads in the brows because they want to look like freaks. So we'll be back with more of that, I guess, later.